I'm Dr. Kasey Holland, the host of our show. The Made to Heal show dives deep into the hidden obstacles that keep people sick, stuck, and searching for answers. From chronic infections and viral reactivations to environmental toxins, burnout, emotional stress, and nervous system dysregulation, we explore the complex roots of illness that conventional medicine often overlooks. Through honest conversations, patient stories, and interviews with leading experts in functional and integrative medicine, you'll learn what it really takes to recover your energy, clarity, and vitality. This isn't another surface level health podcast. It's a journey into the real mechanisms of healing, empowerment, and transformation. Because you weren't made to just struggle, you were made to heal and thrive. Welcome back to the Made to Heal show. Today we have Dr. Eboni Cornish joining us. Dr. Eboni Cornish is a physician, educator, and thought leader at the forefront of brain health and longevity. As Associate Medical Director at Amen Clinics, she brings a brain-first approach to optimizing performance, preventing cognitive decline, and addressing complex chronic conditions. She is the creator of the NeuroLongevity Framework, which focuses on the root causes that impact how we think, feel, and function, from neuroinflammation and chronic infections to hormones, environmental toxicity, gut health, and nervous system regulation. Dr. Cornish is a sought-after speaker and educator, having presented at leading industry events, including the Vibrant Wellness Annual Summit, where she serves as a key opinion leader. She is also president of the board of the International Lyme and Associated Diseases Society, ILADS. Her work bridges the gap between functional medicine, mental health, and human performance, helping individuals and practitioners alike understand the true longevity starts with the brain. Thank you for joining us, Dr. Eboni. I am really excited to have you on the show.
Oh, thank you for the invitation. We're going to have fun. We're going to have a good time.
Absolutely. So, what led you into where you are now doing a full tour on neurolongevity health?
So it's interesting because I started at traditional family practice because I'm board certified family medicine and got bored. And so I was looking for a job randomly in Craigslist, and it said for doctors who think outside the box. And I was like, yeah, that's perfect. And it ended up being a practice that specialized in treating chronic Lyme disease and tick-borne illnesses. And then from there, I learned about functional medicine, but all the while, with the brain, I remember, my own family history. My mom and my grandmother both had dementia. And so when I started treating patients with from Amen clinics who had mental health imbalances or just something we call brain inflammation that we could see on brain imaging, it just brought me back to my family, the things that I need to be proactive with, and test for, and how I can love my brain better because I saw some of the consequences that happened when he didn't love it. And so as I went through that transition in my life and also in my career, I couldn't turn back. It was like all these conditions, people's brains can't improve. It retreat the root causes. Things are reversible, dementia is reversible, diabetes is reversible, brain inflammation is reversible. And that's the journey God placed me on, and I'm going to be here for the rest of my life.
Yeah, I always think it's amazing when it becomes that personal. My grandma also had really severe dementia, and she actually passed away while I was in naturopathic medical school. And I remember being like, if I had known these things sooner, we could have reversed this. It just and it really does light a bigger, just it makes you more kind of close tied to the work and seeing it play out in real time. And at that point when she had it, it was still where research was like, yeah, there could be some environmental factors. Probably 75% is environmental factors, but the only research was on the genetics. Like there was no actual studies on the environmental factors. And now we have so much more available, which is amazing and something that I'm sure we'll chat about. So you are, I mean, how many SPECT scans have you looked at approximately with patients? I mean, that's what's great. You have so much experience.
Yeah, so just for your audience to know, so what we're talking about is brain imaging. SPECT scan what we do at Amen Clinics, it's like a 3D image of your brain. So I can look and say, oh, these are the areas that are working too hard. These areas aren't working hard enough. And maybe there's another root cause. So you might have, because we know mental health is brain health, so we might have some conditions that impact your mood. And then we look at the root cause and we're like, oh, wow, there's a traumatic brain injury, there's inflammation. And so then I start doing the deep digging, like, okay, this person has a fog, they have low energy, they have neurological changes, but what's happening? Let me look at their brain. And then I see signs of inflammation. So at our clinic, at the Amen Clinics, we have over 250,000 brain scans as far as a functional medicine perspective and what I do, because I have a 2-week intensive program where really sick patients who might have Lyme disease, mold illness, they travel because the question is it inflammatory or not, right? I got neurological symptoms, but does it matter? Or I have colleagues who will send me patients with the same thing. Like, I've been treating them for so long, they're doing everything right, they look better, or they're clinically stuck. So is this a neurological problem or not? And so that's where the brain scan imaging, you're like, wait, it might be this, it might be that. Let's try to fix it, or let's redirect our path. So I would say, from a functional medicine standpoint, where I'm looking at brain longevity, biomarkers, as well as root causes of inflammation, I probably had like 2 to 3,000 of those, specifically because I'm the only doctor at Amen Clinic who is functional medicine and not psychiatry, who's looking at brain scans in conjunction with Amen Clinic and independently. So I look at it differently. Like, do these biomarkers matter? Because how many people have had 30, 40,000 tests done, right? And they have closets full of supplements, but then they don't feel well. And they're doing the peptides and they're doing the exercise and they're eating gluten-free, dairy-free, and we don't know what's still wrong with their brain. And that's where SPECT imaging happens. Or people who have seen 6, 7 doctors and they're brilliant doctors, but they're still taking medication for mold illness or Lyme disease, or been diagnosed with MS or Parkinsonian and even dementia, right? And when you look at the brain scan, you can actually say, and that's where it's so cool, like, look, you're on the wrong path. You might have sleep apnea. You might have hit your head. Your brain is in this locked response and doesn't feel safe to heal. So we need to do something a little different, because treating these toxins and these lab markers are not going to be enough. So that's why I love scans and how I use SPECT scan imaging in conjunction with understanding the root cause of mental health, of depression, anxiety, bipolar, etc., because it just provides so much value and it answers so many good questions. Because that's what I see every day: the complex patient or the healthy patient who's doing everything right and they're still having the fog and the neurological changes.
Yeah, that is, it's really what I wish it was like more commonly used, right? Like, instead of just an MRI being the only kind of tool that we use to rule out if there's actual damage to the brain. I wish it was more available, and it probably will be someday. But just so that our listeners kind of understand, how does this specialty imaging, the SPECT imaging, how does it differ from an MRI? Because I get a lot of patients where I'll be like, well, I think we still have some things to work on from, you know, your traumatic brain injury, or maybe your Lyme disease is more progressed than we realize neurologically. And they'll say, well, I had an MRI, I've had 2 MRIs, and it's clear. So how does that, what you're looking at, compare to those standard MRIs that people are getting done?
Oh, it's completely different, because what we're going to look at is actual function of the brain. Like, we're looking, it's like the equivalent of me taking your brain literally out of your head, seeing what areas of your brain has activity. And the coolest thing is that there are certain areas where you'll see decreased blood flow. Like, for example, have a lot of patients who have cognitive impairment and they're worried about, oh, do I have, focus problems, right? Or is it dementia? And I can actually look at the scan and tell you what's going on with the area of your brain that hijacks where your dopamine is needed. That's the front of the brain called the prefrontal cortex. So that front is what makes us like have a good attention, focus, etc. Then I can look at the sides of your brain and I'll be able to tell, okay, this is another area, temporal lobe, that's responsible for memory. So if both of those areas have decreased activity, then I'm thinking memory changes might be due to this. Maybe this person hit their head, maybe there's another approach, or it might just be inflammation. And then the best part is that the back of your brain, which is the executive function, the cerebellum, if I see that there are problems there, I'm like, whoa, 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 whoa. This is inflammatory. I got to increase blood flow. I got to be thinking of things like that are going to help overall perfusion, which is blood flow throughout the brain. And then I can look for signs of inflammation. Those are specific signs as well that will tell me, okay, is this still an active replicating toxin today? Or maybe I should look at, the other things and I can see, oh, maybe it is, sleep apnea. And the most fascinating thing that I can determine by looking at a brain scan is I try to answer the question of why aren't you healing? And in a lot of my Lyme patients or just patients who suffer from common complex illnesses and they've been gaslit and they've been told it's all in their head. Well, what they can go through is trauma, okay? Or a fight or flight. Or they might have histamine imbalances. And guess what? When I'm looking at the brain scan, I'm looking at something called the limbic system, which keeps your brain tight. It keeps you in fight or flight, and we can see if they're overstimulated, they're functioning too much. And in that patient, which is a majority of my patients, I have to use special techniques outside of giving them all the supplements and meds because I have to calm that brain down. And I don't know that unless I really look, because if not, I'm like, oh, they just have mast cell problems. They just have this problem. Let me just keep this. Let me throw this. And then I'm like, wait. This was the most fascinating part of this treatment journey for this patient because you see that you need to give them maybe what's called biofeedback or neural feedback or devices that they can wear that can calm the vagus nerve or any other type of what we call neuromodulation that makes the brain feel safe to heal. And it's interesting because my first patient from Amen Clinic, so we collaborated quite a bit because they would see abnormal scans and like, Ebony, what is this? Figure out the root cause, right? And so she had been through 8 different antidepressants, in and out the hospital for over a year and a half, psychiatric hospital. And we saw that her brain scan was inflammatory. But then I took it a step back and deeper and I asked myself, well, why is she not responding to all of this? And that's because her limbic system was locked. And that prevents healing. And doctors miss that all the time. And when we thought, oh yeah, she probably has mast cell activation. Yes, she had that, but she also had a brain that needed to be calmed down, like even primal trust or Apollo Neuro, like programs, devices that people can do to just reset that part of their brain. And then not only was she able to respond to treatment better, but she felt safer. Her brain was calmer and the healing process took place. So those are things that I love about brain scan imaging, things like that you can't just get from an MRI alone that only focuses on, just structures. And, they might say, oh, non-specific white matter. Well, what does that mean? What is actually happening today? And that's why I find my tool, SPECT scan imaging, very helpful in my practice.
Yeah, and I think it's incredibly powerful that it gives you an objective way to look and see what the limbic system is doing. Because I know in practice, in the first visit, I'm always trying to assess, is this patient, what's their nervous system doing? Do they feel safe? Are they even going to respond very well to therapy or do we have foundations to do like their nervous system? And we can do that, we can check their heart rate variability. We can just talk and get an assessment. Like some people will be really honest. And I had one patient the other day and she was like, I just kind of feel like as I go through life, I'm just waiting for the other shoe to drop. Like I'm waiting for, she had had a lot of traumas and she was still stuck, just waiting for the next trauma. And so then it's really obvious, like, oh, we need to work on your nervous system too. But to have this imaging and be able to objectively look at it without, the patient trying to figure it out is so powerful. And also, I love the treatments that you brought up, like biofeedback and vagus nerve devices, because sometimes, you know, telling a patient, okay, well, you just need to do more breath work or you need to do EDMR or these things, they can be effective, but they can take so long to actually bring that brain response back to center and calm down. And during my residency, I was at a really large integrative clinic in Atlanta, and they had the biofeedback with the brain mapping where basically they assess the brain and then they have a program and you put on these little glasses and it helps train the brain to calm down. We also had devices that we used actually a lot on veterans with PTSD for the vagus nerve. And back then that was kind of newer to use like an external vagus nerve stimulator device. And those were some of the best things for people because it wasn't, oh, well, you have to figure out how to get yourself out of that because sometimes you can do all the things right. You can be trying to do breath work and EDMR, counseling, trauma-informed care, but it's really hard your brain has neuroplasticity and those pathways of trauma get entrapped. And so these tools can be really helpful. So if you're listening right now, and you know that you have nervous system dysregulation or trauma or whatnot, these are tools that you can consider that you might not have heard of before. um,
Yeah, and a lot of them are covered. You can find people in your area to help. And I know a lot of my patients, like I said earlier, with the histamine problems, that patient who's listening, and may respond negatively to everything. You got 500 supplements. I know that's a lot, but I have seen it that you can't tolerate. You have mast cell issues. You're hyperactive. You're responding negatively to things. That whole diagnosis has been made. And then you might have the triggers as well that can cause that problem to occur. That's absolutely right. Neurofeedback, biofeedback, those what we call modulating techniques that are readily and easily available are there. And even someone who might be listening, like, oh, those are really big words. I have patients start with doing things like DNRS. It's online programs like Primal Trust and Gupta program, relatively inexpensive, and they're videos that teach you how to calm your limbic system. And then for that person who's done all the work, you've done these neuromodulation modalities, well, that's when you think about the imaging, and that can tell you what might be missing. Because I had a patient, she was sent from a doctor and she was on doing all the vagal nerve stimulation. She had been through 40 sessions of biofeedback. She had been through other therapy modalities like EMDR, and she still wasn't calm. However, her brain scan showed that she had both sleep apnea and a traumatic brain injury, right? So her limbic system was calmer, but a damaged brain. And when you're starving your brain cells because they're not getting enough oxygen because you have apnea, that's a whole different ballgame. You got to think about treating that root cause. And that's why I love brain imaging, because in that case, it was so helpful because she had spent all these resources, all these years. She was eating right, she was exercising, and she just had paid all these programs and devices. And we had not treated her with a CPAP, nor did she treat her traumatic brain injury. And she forgot to even tell people that, she was playing lacrosse, and had played soccer, it's things like that, and had 3 car accidents. So everything is about brain longevity. finding out why you're not better, okay? And it's layered approach. So the neurofeedback limbic system is just one small part, but it's essential if you're listening today and you're stuck. But it's also, I tell patients, it's not that fancy, right? You definitely need the faith piece because I'm really big in faith and having that inspiration that you can get better. You also need to understand your hormones because that's essential because you can do all the work that you want. And if someone hasn't tested your hormones, like I had this poor lady who came to my office and she was getting treated for tick-borne diseases and she was kind of doing better and then wasn't getting over that last hump, and her brain scan was a little inflammatory. Her limbic system looked great, but her thyroid was impaired and no one had checked or treated her female hormones. So that's another thing when you think about neurolongevity and brain imaging, the basics. What's going on with your female and male hormones? What's happening with your sleep? Like we talked about sleep apnea. What's going on with your gut? And the list goes on and on. And I'm sure we'll get through each one of those topics, but that's all a part of neurolongevity. So it's not just having an image, even though the image can help. It's not just having one diagnosis because, yeah, I see the most complex patients. They've been seeing 5 or 6 doctors before they come to my office, right? It's about setting that foundation for brain healing, using common sense and saying to yourself, okay, like what is missing? What's the puzzle piece? What's the detective work? But not forgetting the basics of what you were trained in school to learn about the human body.
And I love that you brought up faith because, I mean, that's the title of the show, Made to Heal. When people believe that, hey, their body was designed to overcome things and it is trying to heal, even when it feels like, it's gone rogue and nothing's working, things are different than if you don't believe that. If you don't believe you're going to get better, those thoughts impact your cellular function. And so having that faith that you are made to heal, that your body was designed to overcome this is so important. And that also plays into the limbic system and feeling safe. But yeah, everything you just said is so important. And what I see in my office a lot is people come in because they have Lyme and they've done all the treatments for Lyme, or they have, this chronic infection like Epstein-Barr virus reactivation or whatever. And I mean, their brain fog is through the roof. Like they can't. I had a mom that she was like, sometimes I feel like it's hard for me to like, verbalize my baby's name. Her brain fog was so bad. And they're doing all these therapies like you're saying, but I think with infections, it's easy to say, oh, you hit your head, your brain could be damaged. We need to treat that. But with infections, it's becoming more apparent now with people leading the way and like the work you're doing. But before it wasn't thought of as, oh, that infection can cause damage to your brain. And and then also, like you're talking about, we can't just kill the infection or just remove the toxin. We have to go back and repair the brain. And part of that is giving it the foundations, like making sure hormone levels are optimal, making sure the thyroid is working, making sure adrenals are working, and your blood pressure is getting oxygen to your brain. I see some people, a lot of times they have the chronic illness and they you know, have been through so much and their adrenals are shot and their blood pressure, they're like, yeah, my blood pressure is always great. I'm like, well, it's 90 over 60. Yeah, it's not high. So you're not, at risk of those type of things. But it being that low tells me that your adrenals are exhausted and you might not be getting all the oxygen and perfusion to your brain that you need to heal. So those things are all pieces, and we can kind of go through that. Let's talk about hormones more because I see this so often, especially with chronic illness, where when you're fighting infections, your body doesn't put energy towards making hormones. Your body recognizes, hey, this isn't a great time to make a baby. We're focused on healing. We're not going to make all your estrogen, testosterone, progesterone. So even women that, and men, but especially women that, they might not be perimenopause yet. I see them and they still have extremely low hormones that we need to support, whether that's, bioidenticals or herbs or whatever. It needs to be supported because hormones impact brain health. So what are some of your approaches with making sure that hormone health is in place?
Yeah, and I always educate women. We are going to have 2/3 risk of Alzheimer's, 2 out of 3. And a lot of it does have to do with our hormonal status. The key hormone that every woman needs to be tested for is estrogen. We need to know estrogen. We need to know what's called your FSH, LH. Of course, you need to know your progesterone, but get this, even as we age, even in midlife, even in our 30s, the levels of estrogen fluctuates and you start making less of it. And you think of like the word advanced maternal age, that's 35. Well, why is that? That's because hormones are shifting at that age, which makes us more vulnerable to inflammation because estrogen is anti-inflammatory. It actually shows that when your estrogen is high, your brain is more protected because it gives you some of these, beneficial factors that we make, one of which is called BDNF. It helps to produce that, and that helps to protect your brain cells. We also know that when estrogen is normal, your inflammation is a lot lower, just systemically as well as in the brain. And one of the most cool things that I found, because we look at normal brain scans as well for, comparison. Like we'll look at your brain compared to, a person normal. And what we find is as women age, we have decreased blood flow and perfusion to the area in the brain called the cerebellum, which is executive function. All right. So if you're thinking about these things, estrogen shifting, changes in blood flow to the brain, changes in inflammation to the brain, decrease in the production of those factors that keep our brain cells safe, well, then we're already at a disadvantage. And it's just a great environment for when we get those pathogens, those infections, those environmental toxins, Lyme disease and co-infections, chronic mold, chronic viruses, COVID, for us to potentially have a worse inflammatory burden because we are already at a disadvantage due to the natural changes in our hormones, right? And that starts at a very young age. So people, when they think, oh yeah, I need to think about my hormones later in life. No, you need to be thinking about your hormones as soon as possible because this change is naturally going to occur. And so when you think about hormones, yes, I replace, depending on the levels. I think that progesterone, which is one of my favorite hormones, especially in those that are premenopausal, perimenopausal, and the differences is, someone's very young who's not having any changes, regular cycle, versus someone who's about to make that change. Periods are lighter, the cycles are longer, you're having those imbalances, mood is shifting, energy is shifting, fog is shifting. And then 10 years after that, you don't have your period anymore. That's when you get into the menopausal range. I'm always making sure, primarily progesterone for all of the above, because that helps you calm. Progesterone is going to signal GABA production, which calms and chills you out, right? It's going to help you sleep. It's going to help you if you're having those premenstrual symptoms, that PMS, that anger during your menstrual cycle when those hormones are shifting in your body. It's just God's best hormone for us, and it's protective, And so that's kind of one of the strategies. And even if someone says, I don't want to do hormones, we're not talking about synthetic hormones. We're not talking about birth control pills. We're talking about even when we say bioidentical, that means identical to what we naturally produce in our bodies. Or B, we can use plant-based alternatives. I have so many patients who might be on, wild yam root or something like Progest, something over the counter that's natural that also helps you produce that progesterone. And then I think if patients are candidates, I always look into estrogen, but I make sure, even though bioidentical estrogen is shown to be preventative and from cancers, and the fact that they've removed the black box warning, I still check it, right? We used to think, oh, estrogen is going to give you a heart attack. I still check it because sometimes I'll find premature decrease in estrogen. And I told you how important it is, but I'll also in patients can find too much estrogen production, which is leading to PMOS, which is a cool new name for PCOS, which is like polyendocrine metabolic ovarian syndrome. So the women is out there having infertility and hair growth and irregular menstrual cycles or none at all. And it's because they have too much estrogen. So I think hormones are key. And then you're looking at the male sex hormones as well, testosterone and DHEA, because if those are low, because women, we have it, we give you replacement, you're not going to have a beard and, things of that nature. But if it's low, you might need that additional support. But if it's high, right, we might need to suppress it. So the key to brain longevity, first step is hormone support. And that also includes, like you were saying earlier, your cortisol. How many of us are stressed? I feel like women are the most stressed people on the planet. We carry the weight of the world, from mama to wife to working to whatever it is, to being stressed, to the workplace, to sleep. We are going to have a risk of high stress hormone. And when that stress hormone is higher, that's also a risk factor for decreased production in some of these other vital female and male sex hormones, because your body is feeling like it's being chased by a bear. You ruin all this adrenaline, you got this high cortisol, and other things are kind of suppressed. So that also needs to be addressed, as well as, of course, thyroid and insulin resistance. So when someone comes to my office, that's like, they're like, what? I'm coming to you either because I have mood problems and they told me you're going to be the one to figure it out, or I have chronic tick-borne diseases and you're talking to me about my hormones. And I say, look, that is the key, because if your hormones are imbalanced, your brain is imbalanced. And if you're a person listening and you're being treated for tick-borne diseases, co-infections, chronic viruses, parasites, all these potential pathogens, environmental toxins, and the like, and no one sat down to have a very serious conversation with you, or even testing your hormones, and also, like I told you earlier, your sleep patterns, then that's hard, because that's the first step of healing. You have to lay that foundation before you do anything else. You have to at least understand it. And if you haven't had that, and even if you haven't had any of these infections and you're feeling off and you're feeling foggy, well, those are basic tests that any doctor can do and assess. Don't let them tell you you're normal and kick you out of there. You must have your hormones evaluated and assessed and treated if needed, if you want your brain to live longer. And I wish my parents, I wish my mother and my grandmother knew that, because I know we never heard the word menopause in my household or parent. We were like, what? I didn't learn perimenopause until like med school. And after I was like, what is this new word people made up? But it's real. The hormones are needed to optimize our brain function and to have brain longevity. All right. As much as oxygen, as much as good foods, got to get your hormones working.
Yeah, one thing that really connected hormones and brain health for me was actually reviewing my grandma's health, and she had had hysterectomy at a very young age and then not been given proper hormone support. So when I look back, I'm like, oh my gosh, that woman had four babies and went through all those hormonal fluctuations and then had a hysterectomy and didn't have proper hormone support. Of course, her brain was starved. And the other thing that I think is really important about hormones is a lot of time hormones, when we support those, other foundations become easier. All of a sudden, you're sleeping at night. All of a sudden, you have that enough energy to exercise, which is another huge non-negotiable thing for brain health. But when you don't have any testosterone, like I also see postpartum, a lot of women, their testosterone is just completely gone, and yeah, you don't, when you have no testosterone, it's kind of like your motivation hormone. It gives you that, like, oh, I'm gonna, get stuff done today. But it also makes it really difficult to build muscle when you don't have testosterone. And so when you take care of your hormones, then all of a sudden, oh, you're exercising. That makes everything better. And you're sleeping, and that makes everything better. So sometimes, even though it seems like, shouldn't I, I'm not sleeping, not doing this, you have to look at the patient and meet them where they are. And a lot of times, if we can get hormones and thyroid and cortisol improved, the basics fall into place. And then maybe you don't always need to be on supportive medications, right? Your body will then, when it's sleeping and exercising, a lot of times it naturally is able to get back to where it's making its own, and you can taper off those medications. So if you're listening and you're like, wow, well, I don't want to go on hormones when I'm 30 and be on them for another 30 years, it doesn't necessarily mean that you have to stay on them for forever. It can just give you that edge to get your body back to how it's supposed to function.
Yeah.
Mhm.
I totally agree with that. And, the other thing, I know I had a patient of mine, she came in and, I collaborate with other functional doctors. Of course I do. And she was doing, this goes back to doing the right thing. She was doing pellets and she had tried creams and she was taking her natural thyroids, but the numbers kept being out of whack. Right. So she was presenting to me, yes, she had an inflammatory brain scan and mood, because we know these hormones can also affect mental health, like depression with low female sex hormones, menopause, and low thyroid, anxiety if those hormones like cortisol are too high. So she was coming to me for natural support and suggestions of, okay, why can't I keep these hormones stable? And that's another thing. You could be getting your hormones and they keep having to get adjusted. And that means you're not looking at inflammation of the brain, because that's where it could be something else going on. And like we said earlier, with things like chronic infections and toxins, the literature shows even in chronic mold that it suppresses an area in your brain called the hypothalamus and its ability to produce something called MSH, which can stimulate, and also a deficiency in stimulating female and male sex hormones. So then you layer that on top, and yeah, you're going to have to keep changing these doses because you're not looking at the root cause of why the hormones are imbalanced in the first place. And the same thing with these chronic infections. They can also cause a neuroinflammatory response that can impact that hypothalamus pituitary axis, because it's all about the brain, right? Everything is about the brain. And so if that is suppressed, then your hormones are also going to be imbalanced as well. So you're going to be taking 8 or 9 things for your adrenals. You're going to be taking hormone support. You're going to be doing the exercise and still not stable. So I say that to that person who's listening as well, who's like, okay, Dr. Cornish, I've done all the hormone stuff and I don't care. I'm still not well. Well, that's a sign you take a step back and you look at the brain, and also you look at those triggers for brain inflammation that you might be missing. Another key piece where I find my patients who have come to my office and they're juggling hormones, or they're not consistent with thyroid, especially, they keep changing their dosage and their forms, is gut health, because the gut and the brain are connected. And one thing that they showed in the literature is that the gluten molecule is very similar in its morphology to that of the thyroid. So if your gut is inflamed and it's fighting off toxic gluten molecules, there is a risk that can increase your risk of thyroid imbalances, because autoimmune just means your immune system is all confused and targeting you. So it starts to create antibodies and to target your thyroid. And we understand that a lot of our immune cells are in your gut as well. And you process some of these hormones like estrogen by in your gut by calcium deglucarate. So, and beta glucuronidase, these are fancy words that you can see. If your beta glucuronidase on a stool test is abnormal, that might tell me a clue that you're having problems with processing estrogen and you might need a supplement to help with that. So gut health is just as important as treating the root cause and also supporting the hormone. So it's not just one thing. Don't just think hormone replacement is the answer. You got to understand your brain, you understand the toxins, and understand your gut as well.
Yeah, especially with patients that, have been to 5 or 6 doctors and have this complex wellness picture, have maybe a tick-borne infection or multiple and Epstein-Barr virus. Like I always tell people, because a lot of people, EBV has been something that usually they might get diagnosed with because it's something that's a little bit more commonly ran conventionally now for fatigue or brain fog. So when I see that their EBV is positive or really high, I always say, okay, that means that we have to look at everything we're talking about, hormones, gut, other infections, because it's never just EBV or just this infection. If it was just that infection, even if it was like that was the only thing going on, we would still need to deal with that infection and then look at what oxidative stress that infection caused on the body, which can lead to changes in the brain. Like things happen when these infections are present. We can't just take away the infection and be like, okay, we're good now. There's damage that happens. There's inflammation, there's cytokine level changes, there's changes in hormones, there's changes in gut health. And some of the times it's the gut health that was making your immune system susceptible to opportunistic infections like Epstein-Barr virus in the first place. We always try, I tell people too, I'm like, we can't say root cause anymore. We have to say root causes because it's like all these things, like what is in your health bucket, Before you were even born, what were you given from an environmental perspective from your mother, like you're born with stuff and then through life happens. So we might not ever know exactly like A plus B led to C, and this is how it happened. But we can get a pretty good idea of with where somebody's at right now, what the big contributors are and what we need to do. And it takes doctors, like you're saying, looking at all of these things. And it takes patients saying, no, I want my hormones tested. No, I want a full thyroid panel, not just my TSH done. And unfortunately, when you feel sick, you shouldn't have to be your advocate too, but you do, especially in the conventional medicine setting, unless you're working with somebody specialized like Dr. Eboni Cornish or another functional medicine provider, naturopathic doctor, that's just how they operate. But in our standard setting, that's not. So if you're listening, part of what you got to take away from this message is you have to advocate and you have to ask for these things. And you also have to reframe how you look at your health, right? You have to recognize that your health is very complex and that it's not just one thing, which as a patient, that's hard because if it's just one thing and you just have to fix one thing, then that's easy and you can get better. So, it's natural to be looking for that one thing or that silver bullet, but there's so much more to it than that. So what Dr. Cornish is saying is just so important. And it's also right in line with our show in regards to listening to your body. If you feel off, do not wait 5 years until your hormones are non-existent to get help. Wow, we have covered a lot and we have so much more that we could talk about, but we are getting to the end of time. So I want to ask Dr. Cornish, while we have her here, if you could leave us with one thing that you share with people, like the number one thing to take away from this, what would it be for our listeners?
The one thing I tell everyone, and this is how I start most appointments, tell me two things you're grateful for, and let's keep the faith and keep fighting through this, because gratitude is so important. I can't stress this enough. Every time I wake up every morning, I don't care how I'm feeling, I write down two things I'm grateful for. When I go to bed with my triplets at night, they're 9 years old, they must tell me one thing they're proud of. Even if it's like, I'm proud of the fact that I ate all my vegetables. Whatever it is, you're grateful for waking up this morning. Because when you're thinking about health and you're listening to health podcasts, especially when it talks about functional medicine, people have all these worries. Can I afford it? Can I do it? I've been gaslit. What is next? But if you focus on what you're grateful for, if you focus on even having faith in something, because I find that having that faith is what's needed and imperative when you're suffering from complex chronic illnesses, because they can be challenging. You have so many external variables like family, or the trauma from the doctors who told you just had anxiety, or the resources you fit to not get better, or just the fear that you don't know what's wrong with you and you're trying all the right things. Well, if you keep that faith, you keep understanding that there are doctors, like I'm president-elect of ILADS, which is a organization of 600 doctors that treat chronic complex illnesses. I work, as you heard, with Amen Clinic, where there are doctors looking at the root cause of things and doctors studying every single day to better understand the human body. Answers are coming. Answers are also available, but just don't let this complex, chronic, whatever it is you're suffering with, to take a toll on your spirit, because it is a spiritual, emotional journey. If you focus one at a time, someone might be listening here in chronic pain and say, whatever, doctor, but just that one or two things you're grateful for, the day is going to get better and you will get better. You just have to keep that faith.
Thank you. I think that is, I mean, I completely agree. That is powerful and incredibly important. Dr. Cornish, where can people find you if they want to? Are you accepting new patients right now?
Yes, I'm accepting new patients. I'm at the Amen Clinics in the Washington, D.C. office. So I treat telehealth. I'm also can be found on my website at dr ebony eboni cornish.com. I'm also on Instagram, where I give helpful tips at dr.dr.ebony. I also train doctors on how to do this work. I've currently trained and recruited doctor in my office who just started, but she's been in functional medicine for years, and she's going to also help accommodate me and be my right hand woman in treating some of these complex chronic conditions, because we need more doctors out there. You know, a lot of us are busy because people are struggling, but it's important to understand doctors like myself are still training others to do the work. So it's not just a Dr. Cornish, but you know, I mentor doctors, I collaborate with doctors. I'm always mentoring myself and learning from others, but those are the easy ways you can approach me directly at our clinic in DC. Through my website, I have contact information there. And also, if you want to just learn, because I don't give medical advice online, you can look at the Instagram as well. And also know, hey, we got other great, cool doctors, both with ILADS and even in my office, which I'm so excited about, who can treat complex chronic illnesses.
Absolutely. If you're listening, those resources will be in the show notes below so you can find them. And yes, I am a member of ILADS and have met wonderful physicians. It's a great community. So if you are looking of where to go or looking for your area, that's a great place to start. Thank you, Dr. Ebony Cornish, for joining us today and providing such an important message for listeners. It has been an honor to have you.
Thank you for the invitation. I hope you guys listen and learn at least one or two cool tips to help you. And I want to pray that you have a better day.